I'm humbled by the trust and confidence the American people have placed in me and in Vice President-elect Harris. And we're ready to get to work addressing the needs of the American people. Today, that work begins. It starts with doing everything possible to get the COVID-19 under control so that we can reopen our businesses safely and sustainably, resume our lives, put this pandemic behind us. And we just received positive news in this fight with the announcement that there's been progress made toward a successful vaccine. Soon, the expectation is the FDA will run a process of rigorous reviews and approvals. And the process must also be grounded in science and fully transparent so the American people can have every confidence that any approved vaccine is safe and effective. At the same time, it's clear that this vaccine, even if approved, will not be widely available for many months yet to come. The challenge before us right now is still immense and growing. And although we are not in office yet, I'm just laying out what we expect to do and hope can be done, some of it between now and the time we are sworn in. But so the purpose of this is to let you know what we're going to do once sworn in. And so there's a need for bold action to fight this pandemic. We're still facing a very dark winter. There are now nearly 10 million COVID cases in the United States. And last week, we topped 120,000 new cases on multiple successive days. Infection rates are going up, hospitalizations are going up, deaths are going up. This crisis claimed nearly 1,000 American lives a day, and nearly 240,000 deaths so far. The projections still indicate we could lose 200,000 more lives in the coming months before a vaccine can be made widely available. So we can't forego the important work that needs to be done between now and then to get our country through the worst wave yet in this pandemic, to reduce the spread, to save lives. So that's why today I've named a COVID-19 Transition Advisory Board comprised of distinguished public health experts to help our transition team translate the Biden-Harris COVID-19 plan into action, a blueprint that we can put in place as soon as Kamala and I are sworn in to office on January 20th, 2021. And we will seek to add other members to this board during this bring additional important perspectives on public health and expertise throughout the transition. This group will advise on detailed plans built on a bedrock of science and to keep compassion, empathy, and care for every American at its core, making rapid testing widely available, more widely available, much more widely available, and building a core of contact tracers who will track and curb this disease while we prioritize getting vaccines first to the most at-risk populations. Developing clear and detailed guidance and providing the necessary resources for small businesses, schools, child care centers to reopen and operate safely and effectively during the pandemic, protecting both workers and the public. Scaling up productive life-saving treatments and therapeutics, and when it's ready, making sure an approved vaccine is distributed equitably and efficiently and free for every American. With cases rising once more, it's imperative that we ramp up our production of personal protective equipment to make sure our brave healthcare workers have what they need to do battle safely against this virus. We're going to get states, cities, and tribes the tests and the supplies they need. We're going to protect vulnerable populations who are at risk, most at risk from this virus, older Americans and those with pre-existing conditions. We're going to address the health and economic disparities that mean this virus is hitting the Black, Latino, Asian American, Pacific Islanders, Native American communities harder than white communities. Focusing on these communities is one of our priorities, not an afterthought. The bottom line, I will spare no effort to turn this pandemic around once we're sworn in on January 20th, to get our kids back to school safely, our businesses growing, and our economy running at full speed again, and to get an approved vaccine manufactured and distributed as quickly as possible to as many Americans as possible, free of charge.